and welcome as folks continue to come in. We've got a little poll up for you guys to use to share with us what kind of organization that you're representing today and how you are celebrating National Rural Health Day. So we do have a lot of federal government folks, so welcome. We have some state government folks, academic institutions, nonprofits, and healthcare facilities, and then some other folks. So hopefully you guys will get a lot out of today's webinar. And it sounds like a lot of people are attending this and other webinars to celebrate Rural Health Day, but also reading about rural health and reaching out to new partners, maybe attending a local celebration about rural health or visiting a facility. And then we have some long answers that I don't know that I can read. So thank you very much for participating in that. It just helps us to get to know where people are coming from. And we appreciate your time and attention today with us. And I'm gonna, all righty. So hello and welcome to everybody. My name is Kelly Kabina. I serve as USDA's Rural Health Liaison, and I am excited to partner with my colleagues across rural development, both our opening speaker as well as our other panelists for this special Rural Health Day webinar. I'm going to be your host, and I'm really glad that you're joining us. For those of you that may be joining us for the first time today, you might not think of USDA as being the place where you would come for a Rural Health Day webinar, but we are really excited that you are joining us with us today. National Rural Health Day is a day of observance to join other organizations to celebrate the power of rural, and we are really excited to do that. So with that, I want to turn it over to our opening speaker, which is our Rural Development State Director of Utah, Michelle Weaver, and she's going to get us started.
Thank you, Kelly, and good afternoon. Welcome, everyone. Thank you for giving me this opportunity to open today's webinar on health. So being the state director for Utah during this administration, it's really given me a unique opportunity. I get to see a lot of different things, and I get to work closely with communities that are facing rural healthcare challenges. I've seen a lot of significant challenges, all the ones that you guys are facing, I think all the ones. Limited access to medical facilities and services, provider shortages, workforce burnout and recruitment. We know that rural communities are facing greater challenges accessing care than their urban counterparts. We also know that only about 10% of physicians are practicing in rural areas. Healthcare takes such a community of providers. We know that, including nurses, nurse practitioners, physicians, assistants, and more. And this can be difficult to recruit for when the rural area lacks housing and other components of community infrastructure. So there are about 1,800 rural hospitals, and since 2020, 21 of those have closed and 17 have converted, so they're no longer providing inpatient care. Hospitals also support 1 in 12 jobs in rural communities. And that's significant. Between 1990 and 2020, rural counties that experienced a within-county hospital enclosure became more economically unequal, with higher unemployment, lower per capita income, lower median household incomes compared to rural counties overall. These rural closures in the counties have also increasingly likely instituted a reduced access to primary care and dental care. So all those professional shortages happen when there's a hospital closure. So I know that USDA is not always who folks think of, as Kelly mentioned, in rural healthcare as a partner, but we are actually a large investor in rural health projects, and along with those infrastructure projects, the social drivers of health like housing, education, economic opportunity. In FY24, RD funded almost $500 million in projects directly related to healthcare, including $46 million in projects addressing mental and behavioral health, and $364 million to support healthcare facilities and emergency medical services. In Utah, we recently completed 2 major renovation projects. In the Northeast, Uinta Basin Healthcare utilized our community facilities program to rehabilitate 2 of their hospitals, one in Vernal, one in Roosevelt. The funding that the Uinta Basin received gave them an opportunity to really consider emphasis on their quality of care. When I went to visit them, This was actually their filtration system. They really put emphasis on sustainability and their quality of care. So patient safety, just simply by creating a private door for cancer patients to access treatments. So they don't have a fear of exposure to other patients. They have dual temperature controls in their dialysis department, and this actually is their filtration system that allows them to reuse the water for dialysis. In their OR rooms, they were able to do the UV germicidal irradiation lights in those rooms. So that was huge. Next slide, Scott. On a more personal note, the rehabilitation project for Moab Regional Hospital, next slide, included a mental health care clinic, a transfusion center, and a testing lab. So my mom lived in Moab and had an autoimmune disease. I live in Salt Lake. It's 240 miles from her house. So this meant that her blood tests and her transfusions could be done a mile from her house, instead of her having to drive 240 miles to the University of Utah. So I understand firsthand how this impacts a rural community, and because I know how it impacted her. In addition to our community facilities programs that are frequently used, other rural developments in healthcare have been through programs like our distance learning and telemedicine grants. That provides access to healthcare providers and specialists by using telehealth services to improve access to quality care and diminish those challenges that are posed by distance and geography. We also recognize that housing has a huge impact on rural healthcare. In FY24, we invested more than $9 billion to support single and multifamily housing, along with self-help projects, housing repair, revitalization, and preservation of affordable housing. Today, we are celebrating the power of rural. And you get to hear about some amazing tools that our amazing team at Rural Development has worked hard to develop. You get to see our rural health website and our rural data gateway. I'm also super honored and excited to announce the official launch of the USDA Rural Health Program Index tool with today's webinar. This tool includes information about programs, resources, and research across all of USDA, not just rural development, that can support rural health. You can search on the site. You'll be able to search kinds of projects, for example, mental health or food and nutrition. You'll be able to research the USDA agency that conducts the work or the type of program or resource, such as grants versus research. So one of the things that you'll be able to, one of the informational sources that you can get on the USDA Rural website is the USDA's Rural America at a Glance, which is a report that was published on November 12th by our USDA Economic Research Service colleagues. This year's report offers a summary of the research conducted by ERS over the year and around rural communities, and it often highlights issues related to rural health. So for this year's report, ERS looked at population ages in rural communities and found that working age populations are shrinking across rural communities while older populations are growing. I think we maybe we all know that already. And we also know that this population shift can reduce the healthcare workforce for a population that is facing an actual increase in healthcare needs. So in short, as we celebrate National Rural Health Day, I really want to spend a second to honor USDA and rural development's commitment to working with rural communities to address these challenges and improve rural prosperity. I really, truly want to express my sincere gratitude for your hard work in healthcare, for you tackling the challenges that you're facing. And I want, again, to thank you for the opportunity to start you off today. I did take myself off camera because I think that the pictures in Utah are much more interesting than I am. But I want to hand the time over now to Kelly. Thank you again for letting me start you off. I want to hand the time over to Kelly to share all the great tools that they have. Thank you so much.
Thank you, Michelle. So that was our opening for the webinar today. We're going to have three presentations. And our presenters include myself, as well as our Rural Health Fellow, Deborah Tellis, and Dr. Casey Martin, who is our uh, Innovation Center's Data Analytic Division's Bridge Chief of Research and Program Evaluation. So I think Tamara has already dropped bios of contact information for all of the speakers today into the chat. So if you are interested in reaching out to any of us, you can do so. So as mentioned, following the presentations, we will have a short time for answering questions. So again, just as a reminder, if you have questions, please go ahead and put them in the Q&A, and we will ask them during the panel discussion. So with that, pleased to get us started. To begin, I'm going to share a little bit of background on rural health and the rural health liaison role and how RD and USDA support rural health. I'll also start a tour of our rural health webpage, and then I'm going to hand it over to Tamara, who will actually take you more in depth into some of the resources that we have to offer, and then we'll turn it over to Casey. So next slide, please. So some of these statistics Michelle covered as well, but if you're observing National Rural Health Day, I'm going to guess you're probably already aware of how important rural America is to all of the country. Rural America is home to more than 46 million people. It's where much of our food and fuel and other important components of our economy are produced. As Michelle mentioned, we know that there are increased barriers to accessing healthcare in rural areas. Going even further back than 2020, since 2005, there's been 193 hospital closures or conversions. We also know that rural areas are more likely to be part of health provider shortage areas, meaning they have fewer providers per capita that is deemed sufficient to provide adequate care. We know that they also face unique challenges with social determinants of health, meaning those things that are about where you live that can impact health just as much as healthcare. Rural areas can face challenges accessing healthy foods with limited grocery store or farmers market options, challenges with transportation, where having a car is a must to get to work or school or healthcare appointments, and public transportation may be very limited. Lack of sufficient supply of housing is also a big struggle everywhere across the country, but it can be magnified in rural areas. And all of these challenges, along with healthcare access, frequently come back to the same issues around greater distances from significant population centers, smaller customer bases that can make it hard to maintain commercial activities like grocery stores, hospitals, and housing developments. But here's the thing. Here's what else we know about rural areas. They are home to some of the most creative and innovative approaches to solving problems. The walls between the organizational silos can sometimes be a little smaller because maybe that person that is on the other end of the phone is somebody you've known your whole life, or maybe your kids play Little League together. There's a huge amount of opportunity in rural communities to approach problems in new ways with new solutions. And across USDA, I think we are all very excited to be part of that. Next slide, please. So this may or may not be your first time coming to a USDA event. So just as a way of orienting you, you might think of USDA as like, hey, that's the place that does the prime grade beef or organic produce or national forests or WIC. But I hope that you'll also, at the end of today's webinar, think about USDA when you think about hospitals and doctors' offices and telemedicine and health and safety training. We are a large agency. We have 8 what we call mission areas. That's what's on this slide. Each of them plays a role in rural health. And I'm just going to highlight a few real quick before we get started. One is our colleagues in the Research, Education, and Economics mission area. We have agencies there like the National Institute of Food and Agriculture that funds cooperative extension, rural health and safety education grants, farm and ranch stress assistance network, to just name a few. RE also houses the Economic Research Service that Michelle mentioned that does Rural America at a glance, and a lot of other really important research. We also have the Food, Nutrition, and Consumer Services mission area, which has a huge role to play in family nutrition and food security. And then rural development, that's the little green box there on the right. That's where I sit in the department, plays a big role in funding capital costs associated with rural economic community development, including for government services, healthcare, and health supports. Next slide, please. So you may already be familiar with rural development, but just in case you aren't, we have 3 agencies within rural development that focus on different areas of rural community development. They are the Rural Housing Service, the Rural Business and Cooperative Service, and the Rural Utilities Service. Rural development, or RD, is really special, I think, because we are primarily staffed at the state office level. So like Michelle that you just heard from, we have state directors in 47 states. So a couple of our states have to share. But these are folks that are out there living and working in the communities that we serve. And I think that's a really special aspect to rural development. When we post these slides, if you're not already working with your state office, you'll be able to click on this map and get a link to the page that has the information about all our state offices. And then there's also a link on this slide that will take you to any open funding announcements at the time. I show you this map because it's one of the first steps in working with rural development is going to your state office. They really are the people that are working on the ground to promote a healthy community and environment through grants and loans, making sure that folks get access to what they need. Next slide, please. Within rural development, I and your other panelists today all sit in the Rural Development Innovation Center. We are a unique organization within USDA in that our job is really to assist the more than 70 programs operated by rural development. We have three ways we do that. We do it through engaging with partners and customers, developing strong policy and regulations to operate our programs, and providing data tools and analysis to better inform decision making. Next slide, please. I mentioned before that rural development funds capital costs in rural communities. We often talk about how rural development can build a community from the ground up. We have more than 70 different programs that we fund. And we're active not only in direct healthcare related projects like hospitals, clinics, and emergency care, but also projects that support the social determinants of health like education, broadband, transportation, and more. We typically make loans. We guarantee commercial loans. We can award grants and support technical assistance programs. But in all those programs, we have only two that have something around health related in the title. So many of our programs you might not realize can be very supportive of rural health. And so that's part of our goal in not only this webinar today, but in the tools that we'll be sharing with you. Next slide, please. And just to give you an idea of the kind of investment that rural development makes in rural healthcare, this is some statistics for FY24, fiscal year 24. So from last October to this last September, we invested almost $500 million in rural healthcare related projects, more than 250 of those projects across almost every state and 15 different programs. So that's pretty typical for a year for us. So it's an important part of our portfolio. Next slide, please. So what is a rural health liaison? I talked about that for just a little bit, just so you can be oriented. That is a position that was created in the 2018 Farm Bill by Congress. They wanted someone that was focused on coordinating across USDA to support rural health across the 8 different mission areas, but also between USDA and the Department of Health and Human Services and other partners. And then also wanted the focus to be on sharing information and data related to USDA programs with our customers, but then also bringing rural health information into USDA programs and sharing it with our partners. One other note I would put on here, and it's our next speaker as well, is we were able to establish a fellowship with the Association of Schools and Programs of Public Health to start having a rural health fellow. That's been a really important aspect of the work that we do, in that the rural health fellow is someone that comes in with a master's of public health degree and a public health focus, which has been a really important aspect in bringing to the work that we do at USDA. And I'll let Tamara tell you more about herself when it gets to be her time. Next slide, please. So just a few accomplishments that we've done over the last couple of years. Really working across the federal government, we've been able to be part of the Food as Medicine Toolkit that was recently launched by Health and Human Services and the National Strategy for Suicide Prevention and the Federal Action Plan that was launched earlier this calendar year. We've got some great partnerships going around childcare and maternal health and farm stress. We've done events to celebrate observances like today for Rural Health Day for Mental Health Awareness Month, and then products like we're going to show you today around our website, our program index, and Tamara has been doing some work on looking at the impacts of our grant programs as well. Next slide, please. And just as a little tease for things that we're going to do moving forward, we want to continue to support community leaders to support their local healthcare and other aspects that affect community health. We're looking at housing and homelessness with our housing program folks and figuring out are there opportunities there to support rural health. We work closely with the folks at the VA, trying to identify opportunities to better support our rural veterans. I mentioned our maternal health work with Health and Human Services and the National Strategy for Suicide Prevention. These are just a few of the things that we'll continue to be doing as we move forward. I think next slide. Yes, so I am going to switch over and share and give you a little bit of a tour of our um, new website. Granted, I can make the technology work for me. Okay, so hopefully you guys can see that. Somebody yell if you can't.
We can see it. Thank you.
Thank you. So this is just a little overview to share with you. We were really excited. We were able to launch this website earlier this year, but we got a little bit of a facelift going into Rural Health Day, so we were excited to be able to share it. And a lot more resources are on the website now. So you'll notice that we do have our observance for Rural Health Day right up here at the top. A couple of other things that I want to highlight really quick is this link here for setting up for email updates. That is for our email list. We promise we won't spam you very much, but when we do see important opportunities, either in USDA or with our partners, we do like to share that with folks that are interested in learning more. We also have a dedicated email address where you can email if you have questions or things you want to talk with us about. And then we also highlight some of our other programs outside of rural development. As I mentioned, uh, in the National Institute of Food and Agriculture's Rural Health and Safety Program, our food and nutrition programs, and economic research service are just a few examples of other opportunities to really focus on rural health across the department. And then Tamara is going to talk with you a little bit more about our program index. Then this section is usually around our events, like our event today. And then down here is some of the different resources and tools. And Tamara is going to walk you through that more in depth in just a second. So I think that's it for me. Tamara, do you want to take over?
Sure. Thanks, Kelly. Hi, everyone. My name is Tamara Tellis, Rural Health Fellow for USDA. I'm actually with the Association of Schools and Programs of Public Health, which is a great organization who supports graduate students and higher who have been in the field of public health or are focusing on public health to have more of those practice skills. So I've been in the field of public health for about a decade now, but this is my first time on the federal level. So it's been great to work with Kelly and really understand what it takes and how I can support her best and build those skills on a different level. And so while I go ahead and now share my screen, hopefully I do this correctly. I will go ahead. Let's see, can everyone see that?
You got it.
Yes, we can.
So as Kelly already showed you, this is kind of our website, but I really want to show, I will focus on the index last, but I want to kind of show you our rural health resources and tools area. So there are 3 different tabs here. The first one is the tabs I'll probably go a little bit more in depth with, but they're everything that Kelly and I have developed or with our partners in the RD Innovation Center. And so these are specifically made for rural health by USDA. Our second tab is what our federal partners or federal family have provided, just kind of the tool hubs for rural health specifically. And then some additional tools from USDA or others that might also be useful in rural health. But while we go to that first tab, so there's this whole section up here, like we had shared with the Rural Health Index, but for your convenience, we also have it right here as well. So it's easy to access. The first infographic that we developed, I will go over here, is the USDA Rural Development Mental Health in Rural America. So we actually made this document this past May for Mental Health Awareness Month, but we quickly adapted it and updated it for the fiscal year of 2024 to make sure that we're sharing the most accurate and updated information with you all. And so right here, we provide like a quick little summary of the challenge in regards of mental and behavioral health in rural communities. And then we share on this side, this blue area, the programs that support behavioral health care or mental health in communities, specifically our rural development programs. We also have a couple of success stories. We will be creating on our website a past like documents, like our archive, so you can see different stories from fiscal year 2023. But these are some current fiscal year 24 success stories on communities who have utilized our programs and have been able to improve their mental behavioral health access and numbers. And so making that kind of a real connection on how to utilize these programs. And on the second page, it's really like a snapshot. So our programs continue. We have a lot, but we also have a snapshot of what our funding actually went towards in the fiscal year of 2024. So you can see it shows the overall of how much was invested in mental health related projects. That was $46.2 million. And so from all of this, it was 69 projects specifically that kind of total this number that were provided across the nation in 31 states or territories, specifically again with those mental health related projects, which is pretty significant. And from these 31 states of the 69 projects, it was all from 4 different programs. So one of these 4 different programs that we have listed here. But as you can see, there's more than 4 programs, so there's more opportunities. And then, of course, we always want to highlight our 998, the Suicide and Crisis Lifeline number. So another tool that we updated is our USDA Rural Development, Rural Health, and What We Do infographic. That's right here again. So in rural development, we do a lot, but health is not really in the title of the work that we do. And so we want to make sure that we really emphasize how our programs really can improve rural health. And that's through those, like Kelly mentioned, those social drivers of health. So thinking about, infrastructure, electricity, broadband, transportation, the rural housing, you name it. And so from this description, we also have different sections just to provide some highlights of the fiscal year 2024 numbers. So from our different buckets. So for this one, it's like telehealth and high-speed broadband. That's multiple programs, but we kind of clump them together because it makes sense, right? When we share it this way. So it'll provide a little description, but then it shows like how much money that was actually spent, provided to our rural communities across our nation and territories. For economic stability, that's really focusing on those funding or opportunities and technical resources to support business growth in rural communities. We have our housing and healthy neighborhoods because, healthy neighborhoods with those green spaces or sidewalks and lights are really important to making sure that you are having those healthy, safe neighborhoods and housing, of course. We also are highlighting our modern water and wastewater infrastructure because it's really important to have clean water for drinking and use that reduces any contamination. So we do a lot of that work as well. Our electric transportation and community infrastructure, that helps drive economic growth. Our emergency medical services, this is mostly our community facilities, loans, and grants that support the purchase of equipment to modernize healthcare facilities or ambulances, what Michelle Weaver had just shared for the state director of Utah, a lot of those stories. And then the mental health and substance use. I'm not sure if you noticed, but this total number is a little bigger than the last infographic that I had shared in regards to mental health. But that's only because we work really closely, like Kelly mentioned, with some of our other colleagues across USDA, most specifically with the National Institute of Food and Agriculture, NIFA. They have 2 programs that we support as well together for rural communities that really emphasize what they're doing on the ground in local communities. And that's the Rural Health and Safety Education Grant and the Farm and Ranch Stress Assistance Network. So we wanted to make sure that we clumped this together to show those efforts. Another one is the Rural Health Liaison infographic. I know Kelly already had shared a bit about what she does, but we want to make sure that we had like a leave behind or some kind of handout to share with others. So it provides kind of that snapshot of what the role, the responsibilities are, and then specifically what we have been able to accomplish within the last year, and 4 different buckets. So the first one is really showing on how we facilitate and develop and coordinate like the tools that we're sharing with you today. So kind of having some numbers there, the tiny URL links to have easy access to those. We also are wanting to share how we have participated in interagency working groups, like Kelly had mentioned. We're on a lot of those, and the last year we were able to have like 3 different tangible results to share. That first was the National Strategy for Suicide Prevention and the first ever federal action plan to accompany it, where we have coordinated across the department with the different mission areas and agencies to identify more than 20 different action items that we will be working and moving this work across the next 3 years in suicide prevention efforts and activities. The Federal Food is Medicine Toolkit, easy link here, and then FEMA National Resilience Guidance. And like Kelly has emphasized, we really do collaborate and work across and network with everyone from our federal partners and family to our non-federal partners at the national, state, local levels. And so right here is like our collaborations that we have are currently that we continue to work towards with the different type of topics. And then we have our new connections as well. As you can see, we are really growing what those new partnerships look like in transportation and cybersecurity. So very exciting stuff as we continue to navigate and get connected with others to help rural health. And then lastly, our next section is assisted with rural health outreach, including presentations, or if we're not able to make those speaking engagements, making sure that we find subject matter experts to present as well. And so these are some of the topics that we've presented at in over 20 speaking engagements in the last year. And then lastly, our USDA rural health success stories. We think this is important to make sure that we're emphasizing because again, our programs, they don't have health and title or the description, but they are very much being able to use to improve rural health. And so we went from the 4 different regions, and we've identified a couple success stories to share to really highlight how these programs can be utilized to improve health. So it's just a little summary here from each area, the tiny URL to get to the actual story. For a larger, in more in depth. But this is also a great area to then look a little deeper if you're interested in some other subject matters or something that you're looking for your community or a colleague that you're working with to kind of see how else others have utilized these grants or loans to improve rural health. So then lastly, we'll do our USDA Rural Health Program Index, the brand new tool we're very excited about. So it's great. Let's let it load. So here it is, very pretty. It's happening, it's here. So this, again, it's not just rural development programs that we have available, but it's programs and resources from across the department. So this is a tool that is basically a curated library of active USDA's programs and resources. We are actively working on improving it. So right now we have about 60 programs listed, but we know there's a lot more. So as we continue to work across the department with our colleagues and share this new tool and try to find additional programs to make sure they're incorporated in here, it will continue to grow. And so have some grace with us as we continue to develop this, but it's pretty good right now, I would say. Yes, we have over 150 programs. But how to best utilize it, if you already have a program, you could definitely type it in here. What I think is best is that you can go through the program type. We have different kind of categories, I guess, for program type that you can select from that are broad. Our assistance type is also available too if you're looking for just grants or loans or just technical assistance, whatever that may be, or if you're looking for a specific sub-agency within USDA to see what resources or programs that they have available. We also have that. We also have a rurality requirement check that we can utilize. We are still working on that, but it'll be here shortly. So that'll be specifically just for rural communities, like for rural development. A lot of our programs or resources are for communities who are, with a population of 20,000 or less. So we can have some of those programs specifically highlighted here. But just to have an example, we can click on mental health. And let's do grants, search, and a list of those opportunities will be populated here. So you can see we have rural development. These programs may be also used for other areas, so it'll show that. These are grants. We also have NIFA. So you can actually select on the program here. It'll bring you to the actual page, or if you're not sure, what is this program, you can click on this plus button and it'll provide a quick description of what that looks like to see if you're more interested and want to actually go to that page. And let's just do one more for the fun of it. And let's do any. And as you can see, more will come as well from different areas of USDA, providing that information in multiple pages you could jump to. I think that's it for now. If you have any questions, of course, please put them in the chat, or we will call out your hand afterwards. Kelly?
Great. Thank you, Tamara. And I think at this time we're going to turn it over to Casey.
Yes, Scott's going to share the slides. I'm Casey Martin. I'm with our data analytics division, specifically over the branch of research and program evaluation. Slide. I'm going to tell you a little bit about our Rural Data Gateway and some exciting ways you can learn more about the investments rural development makes in rural communities. Next slide. So I'm going to be very brief on this slide because my colleagues have covered a lot of this information. Sorry, I muted myself. Rural development is really the World Bank for rural America. We are the 14th largest bank in the United States and do everything, as mentioned, from direct loans to guaranteed loans, grants, and technical assistance. And so next slide. So a little bit of background on the Rural Data Gateway. One thing to kind of keep in mind or note that the Foundations for Evidence-Based Policymaking Act passed in 2018, and it really encourages and makes federal agencies responsible for being more transparent about what they are doing and sharing their data with the public. And this effort, this Rural Data Gateway, is our vehicle for which to have that transparency, to share the work that we're doing and share the investments we are making. And so this work was accomplished through USDA's Rural Development Data Governance Board, which has representation across from our programs and different leadership. All right, next slide. And so the Rural Data Gateway highlights our investments into rural America and has several different visualizations and views in which you can look at the data and think about the data. And we're going to do a demo of the site in just a few minutes. Next slide. So there, as I said, I'm going to show you some of the different dynamic visualizations. You can look at it from everything from your state level to congressional district to by program. You can even download all of the data we make available. So if you have a project or are interested in digging into the data more yourself, you have the ability to do that. Next slide. So a little bit about the data. So the data concludes over 12 years of data, starting with fiscal year 2012 and going to FY25. It is important to note that the data is what's been publicly announced. So with all of our investments, we announce those and make it known to Congress what we are doing and make it known to our stakeholders. And so part of that process, once that has happened, then the data gets added to the Rural Data Gateway. We have about a weekly refresh of the data, putting in new data that has been announced. It is important, very important to note this is not a financial report of record and that the data is dynamic, meaning that rural development data, the numbers can change based upon whether or not the project was continuing to move forward with, or if they needed to expand funding, or if they just had to cancel it altogether. So you can see and can see those changes within the data. We also only aggregate single-family housing data to the county as a way to protect and comply with privacy requirements. And for our telecom and electric programs, because they are really service area-based programs, you can really only see those programs kind of at the state and national view. They are not included in the county and congressional district views. But the next slide. And one thing that is coming soon that I think will be of a special interest to the attendees of this webinar is we will have visualizations that really help unpack rural development investments by industry. So you can see, how much of our dollars are going to healthcare related investments, how much of the funding we have is going to broadband, other utilities, housing, and can really unpack that. And you'll be able to do that by fiscal year, program, congressional districts, and other geographies. And so we're really excited about that, and that will be coming soon. It's in the final stages of testing on the test site for the website. So we're excited to be able to launch that soon. But this just gives you a sneak peek of what some of those visualizations will look like. All right. Next slide. Now the fun part. So I'm going to steal the screen. And share my screen. So move all this around. So this is what it looks like when you first come to the Rural Data Gateway. It gives you a little bit about, who we are, what we're trying to accomplish, and really share, this is a way for us to show and spotlight the investments we're making under our programs and our impact on rural America. And so you enter the site this way by clicking on rural investment. We'll see we provide an overview of the different dashboards that are available. Let me take just a minute to load. And so the first view shows this national overview of starting from 2012 to what has been announced so far in fiscal year 2025, which started October 1. We've made $383.2 billion in rural investment in rural communities. And so the state map shows you the concentration of those investments. The darker green, the greater the investment. The lighter color, the lighter yellow and lighter green represent less investment. So when you hover over, so if we look at Virginia, where I'm located, you can see that the investments made in Virginia represent 17 billion of those investments in rural communities. And so it gives you different ways to filter. You can select different fiscal years. If you weren't interested in seeing everything, you can look at it from the view of the dollars invested, the number of investments, and then something that we utilize to think about how we get our dollars to those communities of most need. And we use the Social Vulnerability Index, which was created by the CDC. And so it shows how we're investing in socially vulnerable communities. And we have some resources here available that tell more about the data and give a quick reference for those who, so as you're thinking about how to navigate this site, how do you use this data, you can look at those. And so those open up to this site right here that tells you a little bit more about the data, as well as the quick reference guide that helps you navigate and lets you know what each of the dashboards does, how to use the filters, what you're seeing. And so those resource documents are linked at the top of each kind of view. So, and at the top here is a way to navigate to the different visualizations. So one of the things you're able to do is to look at rural development's investments by program area. If we want to look at community facilities, who we know does a lot of our investments in health-related fields, whether it's hospitals or clinics, or mental health care, you can just choose the program. Limit data. Click that to remove the menu, and so it shows you across this time period. So we could just look at this last administration. Investments that have been made. So it allows you to filter the data and change it, and just takes a second to make the change. And so you can see, and can even change the data to be looking at just one state by clicking into the map. And so it'll show you across the different fiscal years how much Alabama has invested in rural communities under the CAF program. And if you're interested in that data, you can just export that to CSV right here. And so that gives you that option. The other thing I'd like to highlight, for all of the data from any of the views, you can use our data download, which has links again to the different guides, but it also has a link to the data dictionary that explains each of the variables and what they're measuring and what view you can see them in, and that they're available in the download. So I mentioned that RD investments by industry, the visualizations are still a new feature that are coming, but we have the industry data by NAICE code available in our data download now. So if you're interested, in that information, you can choose industry sector. We can choose health. And it'll tell you, okay, there's 63 records for fiscal year 24 that have been related to health that we can, see that data. If we want to see more years, we could select more years. If we were interested in a specific state, you could limit that. But if you're interested in all the data, you would just go from here and go right to exporting to CSV. And to save us time, I've already done this and have it saved to my desktop so it'll show up. This, where you can see, it tells you the fiscal year. So you get all the different investments related to health by fiscal year. You can see that it was under mainly our business programs and community facilities, what programs there are. Here's our direct facility, community facilities loans, some community facilities grants, our Rural Energy for America program. So all kinds of different things. And it tells you if the investment was made to a socially vulnerable community or not, as well as the project name. And this is one of the things that I think is most interesting. It gives you more details about the project. So like, for example, this one here, it was for $309 million of funding to go and fund the building of a whole new hospital, 200-bed hospital. And so it tells you about what that funding goes toward. And this is all stuff you can download and utilize. And coming soon, there'll be more visualizations to go along with this data related to investments by industry. But this kind of gives you a sense of what you can download. Back to our, so I'm going to stop sharing my screen and hand it back to Kelly. But that's just a little brief introduction to our Rural Data Gateway. And we hope you'll explore the data, and please reach out to us if you have questions or are interested in more data. Thank you, Kelly.
All right, thank you. And if you want to come back on camera, Casey, we can start into our questions. This is a QR code slide, so if you want to take a quick picture of that, gets you to lots of different links around rural development that you might find interesting. And then I think we have at least one raised hand, right, Scott?
Yes, we do, Kelly. So, Deanne, if I've just unmuted you, so if you'd like to unmute yourself and ask the question to the group, you're more than welcome. And Deanne, if you're looking for the mute button, it's in the lower left-hand corner. Okay, we seem to have any difficulties, Deanne. If you want to just go ahead and retry to raise your hand, we'll get you going here. And I don't see any more raised hands, but there is a question in the chat, Kelly, if you guys are ready for it.
Sure.
Okay. Are there navigators to help nonprofit work through the right programs for the plans and slash actions we implement? And how is RD addressing the barriers to help for rural health and housing when the main barrier may be the USDA paperwork? And who can help with the paperwork for our elderly folks?
Those are really important questions. I think there's a number of different ways we can approach that, but I'm always a big fan of starting with your rural development state office. These are the folks that know the most about our programs and know how best to figure out what's the right opportunity for you as you're working through that. They are also super helpful in navigating the paperwork process as well. We do realize that as a federal agency, we have a lot of requirements placed on us that can result in some paperwork, and our state office folks are just expert at all of those things. I would also add we do provide funding for some technical assistance providers across all of our different programs. And for certain programs, those technical assistance providers may be able to also be helpful to potential applicants of helping them to flesh out a project or figure out what paperwork is needed or what kinds of analysis they might need to conduct to be able to apply for the program. So I would say both of those areas are good places to start. And certainly, I see Tamara's putting links in the chat. So our state directors are great places to start, our state offices. And then also our website is a great place to find specific technical assistance providers for the specific programs.
Thank you, Kelly. Next question. For the index, how often is it updated?
So brand new index. We actually just updated it before we got it put up there, but we are planning to try to go through and make sure everything is working and everything is up to date, probably about every 6 months. Most of our programs are funded through the annual congressional appropriations process, so they don't typically change how they are structured or what they do more quickly than that. But we do know that links change on our websites over time as new technology and new standards come about. So we have had a version of this index internally facing for a year or so for USDA employees, and we found going through it before we launched the index that a lot of our links needed to be updated. So we're going to try to go through at least twice a year and click on every link and make sure everything still goes where it's supposed to go, but also reach out to our partners in the other programs and make sure that we're still representing the work that they do properly.
Awesome. Thank you, Kelly. And kind of along that note, we're getting some kudos in the chat. It says wonderful presentation. But she's wondering if any data goes down to the county level.
I'm going to let Casey answer that one.
Yes. So we have both visualizations that go down to the county level, as well as congressional districts. And then when you download the data, it actually goes down to the project level, except for single family housing, which is only aggregated to the county level. So you can get row by row level data for the other programs and then to the county for single family housing. But we have visualizations that help you see the county level, and then the investments in socially vulnerable communities actually goes down to the census tract. The socially vulnerable index is done at the census tract. So yes, multiple geographies. And I hope you look and check out, and if you have any questions about those visualizations, please send me an email. I'd be happy to demo that for you.
Thank you, Casey. Now, will this recording be published on the website or where will we'll be able to find the presentation?
We will publish the recording on the Rural Health webpage as soon as we get it all polished up and produced and ready to be put forward. I think that's correct me if I'm wrong, it's usually a few weeks before we can get that all put together.
Thank you. We have a couple questions regarding how to get to the county level, and then also that we need more help on the county level. So I don't know, Casey. Without going into the demo or quickly, can you tell them how to drill down to the county level one more time?
Sure, yes. But can I share my screen real quick? It'll
Yeah,
just
that'd be
take
great.
a
Actually, yeah, that's perfect.
second.
And then while that's sharing, I have one more question coming from the chat. Is there one health fellow nationwide?
Yes, Tamara, is it? No, yes, there is. So there is one rural health liaison and one rural health fellow. We are really here to support our colleagues across USDA. We do have folks, again, like I said, I'm a huge fan of our state office staff. They do a lot of really great work. So what we do is try to help them on individual projects or questions that they may have. If we don't have the answers, we try to connect them with folks that do, to be able to help support the projects that they're working on. But yes, there's just the two of us.
Wow, great work
But
being done. Thank you.
I did want to flag, because Tamara reminded me to do so. There are opportunities with the Association of Schools and Programs, Schools and Programs of Public Health. Sorry, I had to get my acronym straight in my head. So you can definitely keep an eye on that if that's something that you might be interested in. And then USDA also has its own internships and career opportunities. So please explore that as well.
Yeah, and for the ASPPH fellowships, for the USDA one, at least I can speak on that. The opening should be released by the end of this month. And then applications will be due shortly after, I believe, like in early January. And then Kelly and I will be working to review those with ASPPH and share who will the next USDA Rural Health Fellow be in what, March? I think that's the timeline it usually is.
You would know better than I would.
Yes, which is great if you're graduating in May, because then you're like prepared and ready to go. But hopefully it'll be a good streamlined transition between us.
And just quickly, so when you're on the investment views of the role data gateway, if you click on state and county view and select your state, then you can get drilled down into the county level data, and it'll show you, you can even choose a specific county. It'll show you a ranking of which counties in that state. We're looking at Virginia right now, have received the most funding across whatever period of time you can look at. And so it shows you, allows you to see that, allows you to see it by program area. So you can even decide, well, I'm really interested in what's happening in Accomack, which is our Eastern Shore. They'll give you that breakdown of all the different programs by county. So this is kind of how you drill down by county. It's going to take just a second. And it changes the visualization. And then it'll show you, okay, that in Accomack County, they've received some value-added producer grants, and facilities, rental assistance for our multifamily housing, farm labor loans and grants, some single-family housing. And if you're interested in just pulling this, you know that it was Accomack that you wanted, this was the information you're interested in, instead of having to go all the way to the data download page, you can just simply export the data from this view and the visualizations related to county. This is how you get to the county. And again, just scroll so fast, but that's part of that. You get there by selecting from the menu up top here. It shows you all the different views. Okay.
Awesome. Thank you, Casey. Appreciate it. Thank you, Tamara. So another question through the chat, and I'll reshare my screen here. I'd like to encourage our folks to, use the Q&A to type a question, or if you prefer to ask a verbal question, and go ahead and raise that virtual hand, and then you'll be able to do so there. One more question through the chat. So forgive me here. With the Data Gateway tool, would this tool be helpful to use and reference when writing a USDA grant?
I don't think that it's helpful. I mean, the way it can be helpful in kind of writing a grant, and we've actually had some use cases of this, is seeing what funding has gone to your area to see what projects rural development has already funded. It may be helpful to even talk to some of those entities to see how they were successful in getting their project funded, but it kind of gives you a sense of what investments we've already made. But in terms of, really citing it, I don't think it's necessary or part of any of our applications to kind of provide that kind of data, but it is informative to think about, what is the footprint of rural development in my community already?
Thank you. And I'm not seeing any raised hands currently or questions coming through the Q&A. Every time I say that, though, we get a couple. So I will hang on a little bit. Let's see here. Are CDS included in this data? Question from the chat.
Yes, and CDS stands for congressionally directed spending.
Thank you.
For those who do not know what that stands for, but yes, congressionally directed spending is also included, and you can actually pull that information by the funding code when you do the data download. You can even see what is congressionally directed, and currently we have congressionally directed spending under our community facilities programs and our water environmental programs.
Awesome. Thank you, Casey. Okay, searching through. I'm not finding any new questions or hands raised. I'd like to should I hand it back over to you, Kelly, and we can wrap up here. And then if anything comes in, I'll chime in and we can get them answered. Does that sound okay?
That sounds great.
Awesome.
Well, thank you to our speakers and also to our attendees for joining us for our Rural Health Day webinar today. It's, such an important day to reflect on the importance of rural health and all of the factors that are so important for healthy rural communities. We celebrate the power of rural every day by playing a major role in supporting rural communities to ensure access to healthcare and the important factors that influence community health and well-being through our many programs and resources and partnerships. We hope that you will spend some time with some of the resources that we shared with you today on the webpage and the program index and the Rural Data Gateway, and stay tuned for more new features as we keep moving along. And certainly feel free to sign up for the email list if you want to hear more announcements from us, and also use our email address if you have questions or comments that you want to share with us. So we really do appreciate your time today. I don't see any other questions, Scott. So look for this recording to be on our website soon, and also the slides. We'll put those up as soon as we can as well. Thank you to everybody.